There are many discomforts throughout pregnancy. I know, I've been there. I've experienced some of the things you're probably experiencing already. Things like sore and tender breast, nausea, headaches or backaches, some emotional discomforts. These are normal things. A lot of these changes and discomforts are normal and common. Some things are more serious and signs to look out for as possible risks of complications. If you notice any of these signs, it's important to seek support from your medical provider. In this chapter, we will cover possible complications related to pregnancy. Swelling. You may experience swelling in the feet and legs towards the end of your pregnancy. With the added weight of pregnancy, your circulation is slower at returning fluid to the heart, especially from down at your feet. If you have excessive swelling in your legs, notify your healthcare provider. Also, notify them if you have swelling in your hands and face. This may be a sign of something more serious. Preeclampsia. Preeclampsia is a disorder that occurs only during pregnancy, typically after 20 weeks. It can also appear up to 6 weeks postpartum. This condition can affect both you and your baby, so proper prenatal care is essential to diagnose and manage preeclampsia. At least 5 to 8% of all pregnancies have this condition. Make sure to consult with your medical professional if you have symptoms of preeclampsia. Vaginal bleeding. If you notice any amount of vaginal bleeding, make sure you talk to your medical provider or go to the emergency room right away. Urinary discomfort. If you notice any signs or symptoms of discomfort when urinating, make sure you tell your medical provider about this, as this could be a sign of an infection. Preterm labor. If you experience 4 or more contractions in less than an hour before 37 weeks, this could be a sign of preterm labor. Make sure you talk to your medical provider, as they may want to monitor the baby's movement and heart rate and make sure everything's okay. If you notice any signs of a decrease in your baby's movement, make sure you tell your medical provider about this. Your provider might want you to monitor kick counts or have you come in for additional monitoring. If you notice any signs of excessive fluid, such as a big gush or a continuous leaking of fluid, this might be premature rupture of membranes. This is when your bag of water breaks before 37 weeks. Call your healthcare provider or go in right away if you notice a premature rupture of membranes before 37 weeks. If you notice any other complication that's concerning to you, always consult with your medical provider or go in to the emergency room just to be sure you and your baby's health is taken care of. Understanding these warning signs and possible risks of complications can help you distinguish between what is common and what is concerning. Remember, always contact your medical provider if you have any concerns about you or the baby's health.